Welcome to Unlocking Jaw Secrets with Myofunctional Therapy and Beyond for comprehensive treatment with Myofunctional. So, this is an advanced clinician course for those that are familiar with myofunctional therapy or at least took an introductory course to myofunctional therapy. And it's going to go over holistic approaches to healing the temporomandibular jaw disorders. Who is this course for? Well, this is a course designed for dentists, registered dental hygienists, speech language pathologists specializing in myofunctional therapy, physical therapists, and occupational therapists. To enroll in this course, it is required that you have completed at least one introductory course to myofunctional therapy. If you need assistance in getting started with myofunctional therapy, feel free to email me directly and I will help and guide you. And I do hope I get a wide variety of clinicians participating in this course, as I do believe that temporomandibular joint disorders is best treated through a collaborative, multidisciplinary approach by involving different types of healthcare professionals. The course can offer more comprehensive strategies for treating temporomandibular jaw disorders, ultimately enhancing the patient's healing process and improving overall outcomes. So it's very important to work with different providers. My journey from oral facial pain to purpose. Treating jaw disorders is both my specialty and passion of mine, and I'm excited to share this knowledge that helped me reclaim a pain-free life. And in this course, I will cover how myofunctional therapy combined with other modalities can effectively relieve pain for those with temporomandibular jaw disorders or those who suffer from any other orofacial pain discomfort. If you don't know me yet, my name is Vita Zhilyak. I live in Pennsylvania and I'm a founder of Maya Vita. And I have been a registered dental hygienist for over 12 years. I've seen hundreds of clients with temporomandibular jaw disorders and sleep issues and helped them thrive. My journey from oral facial pain to purpose started with my own personal struggles with sleep that began when I was 5, accompanied by chronic fatigue, anxiety, panic attacks, and persistent jaw pain and body pain that started around age 17. This all symptoms intensified after I had my premolars removed, and that was at the age of 17 for orthodontic treatment, which led to further jaw retrusion, and that also led me to have even more pain um, and I was confused why everything was happening to me, and I just tried to seek answers. So this all led me to explore both holistic and medical solutions to reclaim my pain-free life, right? Despite extensive efforts, including significant investment, I've tried numerous approaches for my jaw pain. I've studied various fields such as muscle health, dental syndromes, homeopathy, naturopathy, fascia, the nervous system, psychosomatics, and the effects of C1, C2 misalignment, and much more through books, courses, and hands-on learning. And I keep learning. So, as a hygienist, I worked alongside with different dental specialists searching for answers. Yet, none of the answers that they were giving me helped me. I mostly work with dentists who specialize in temporomandibular jaw disorders or bite reconstruction, right, to get that bite back to help them with their jaw pain. So none of the devices they gave me improved my condition. In fact, they often made my jaw pain worse. The only answer I was hearing from them was that my case was too complicated and that I would most likely need a jaw surgery to get rid of my pain and also to help with my sleep apnea. So my life changed forever when Carice Laguerre covered in my office and suggested I reconsider my approach to jaw issues, which back in the day was night guards. I was the queen of night guards. It was night guards, NTIs, and different splints, right? So she has emphasized the importance of muscle function, sleep apnea, and tongue ties. Initially confused, I began researching myofunctional therapy, and just like many of you, got into that rabbit hole of airway and tongue ties. After Carice encouraged me to enroll in her course, I did so, and within 2 months, my severe chronic jaw pain significantly improved, and so was my sleep, right? So this was me during my during the first lectures of the initial my functional therapy course I took, and there's so many things wrong with this picture, right? You can see that I'm in constant pain, and I'm constantly massaging that left side. So um, my pain was on my right side. My muscles would spasm. Right, so my masseter would spasm, and my lateral thoracics were firing out both sides, but mostly on my right side. My jaw joint would click and pop and lock on my left side. So, and in those pictures, you can see in how much pain I was. I was constantly massaging my jaw. I was a mouth breather. My muscles were spasming. I had bad habits like leaning. Like on this picture, I am leaning right on that hand because I feel like I'm supporting that jaw, right? Because I'm like putting that hand there, trying to support it. But what I'm actually doing is getting that jaw joint out of alignment, which I know now. But back in the day, I didn't. And again, I worked in dentistry. I worked with those jaw doctors, and no one talked about those bad habits, right? And the posture and hand leaning that can put so much stress on that jaw, right? I was doing all of those bad habits throughout the years, and actually about breathing. I didn't even know I was a mouth breather, right? So after doing my functional therapy, so this is me before my functional therapies. This is my nose. I do have deviated septum because of my narrow jaw. My maxilla is so narrow because of the extraction and all the movement they did. So I got that deviated septum. So, and I wasn't using my nose. Of course, those muscles are going to be weak. So I started using my nose. I started nasal breathing. I got my oxygen back through my nose. And then look at my tongue. Look at my airway. I had like a Malampati of 4. And now, so this is 2 months post op, and I'm even like, you can literally, like, my soft bell is like right here right now. So everything have drastically changed, and I felt relief from my jaw pain. My muscles were not spasming anymore. Not to mention, first time ever since I remember, I slept better and my breathing has improved. And so with the breathing, my anxiety and panic attacks improved. Like I stopped getting them as much, right? So last year, after trying sleep devices to help with my mild sleep apnea, because I still have mild sleep apnea, you can get that fixed because my jaw is so far back, right? Like leaning on my spine on that C1, C2. I'm very retruded from profile, right? So I was trying different sleep appliances, right? Mandible advancement devices, and last year after trying all like this different sleep appliances, they were triggering my jaw pain, but it was a different kind of pain. It was a pain that I never experienced before, and it led me to explore more. And when I went to my dentist that gave me the sleep appliance, she was like, "Oh, it's your jaw acting out again." And I was like, "No, why would it act out from a sleep appliance? If I healed my jaw with my functional therapy, my muscles don't spasm anymore. I don't get this pain. This is a different pain." And as a jaw patient myself, I believe me, every jaw patient who had a chronic jaw issues, they know, and you help them fix those jaw issues, you help them get them out of pain, they remember the pain. It's like it's a PTSD. We all have that PTSD, whoever suffer with jaw issues. And I know that pain. Like if I can tell you that pain, even though I haven't felt that pain in so long, I can explain it to the bit that pain, because every time I get into the chair, every time I do certain things, I still have that thought of getting that, like, oh my god, this is going to trigger my jaw pain, right? So I know that it was a different pain, and it was like a shooting nerve pain coming from this side. So this is my left side, so it was coming from here to here, and it was throbbing. It was, and I don't have root canals, I never had a root canal, and it was kind of like a nerve pain. So when I explained it to her, all my nerve pain and stuff, and she was like, let's check your CT scan that we took, right, for that sleep device. We checked the CT scan, and then she told me, it was like, oh my God, like you have Eagle syndrome. And I'm like, what is Eagle syndrome? And she's like, this, it's a stylohyaloid ligament that gets calcified due to trauma. And I was like, I've never heard that before. And so that's an Eagle syndrome. You can see it on panoramic. I can look back to 2007 when I got my braces on. It was my first panoramic I got. I had that ligament calcified there. So this is my left side. I have that ligament calcified from both sides. So you can see a little bit on the right, but this is my left side. And it's actually almost like touching the jaw. But there's a nerve going through there, right? So if there's certain movements that can cause that nerve pinch, and that person will get that severe pain. Especially, I've been getting those clients where they either they reach out and find me, or a dentist, local dentist, refer them to me because they got that pain, this neurological pain, after having their sleep device. So I'm that go person to help them with their Eagle syndrome and help them with that pain to go away, and to help the doctors understand why they got that pain in the first place, right, from that sleep device. So since then, I've been researching since I realized I have Eagle syndrome. I've been researching and experimenting with various appliances and techniques, both medical, holistic remedies to help manage orofacial pain and sleep apnea, that to help someone who has Eagle syndrome or someone who has temporomandibular joint issues, right? To see what appliance will help them to sleep better, right, without aggravating their jaw. So that's what I'm doing. That's my research right now, and I'm constantly looking into different appliances, different things that help with the jaw pain. So sometimes I would like trigger certain things in my jaw pain, so I can try out a thing, like an appliance or posture corrector or wherever. So this firsthand experience is what makes me such an effective therapist. I truly understand temporomandibular disorder patients because I am one myself. I know what provides relief and what aggravates the jaw. And when I started doing all those exercises in the initial course, there were certain exercises that were triggering my jaw pain, and there were certain ones that were helping it. So I adjusted them to myself, and I adjusted them to all of the clients that I would get in my schedule. I'll be like, no, like we'll do this, we'll do that. We're not going to do this exercise because this exercise is going to harm you. And I at that point, I thought that everyone knew that, but apparently no, because not every myofunctional therapist, that's good. It's a good thing that not every myofunctional therapist had jaw pain, because it's a horrendous pain that I don't wish on anyone. So before this year, my mission in life was to empower individuals trapped in chronic facial pain by providing tools, resources, and support for future self with vitality and joy through education, advocacy, and personalized guidance. I aim to help those people reclaim their lives, discover resilience, and thrive. But this year, I expanded my mission statement to include coaching and lecturing, because through my own recovery from orofacial pain, I discovered numerous strategies and modalities that many practitioners were just not aware of. By sharing this knowledge, I aim to help a broader audience and overcome temporomandibular jaw disorders and orofacial pain. That's why, because it's just me, but if I'm able to teach so many more practitioners to how to get to the root cause of that temporomandibular disorders and that orofacial pain, I'll be able to help more people. So we all know the four goals of myofunctional therapy, right? So The goal of this course is to help you feel more confident in treating patients with temporomandibular jaw disorders by providing practical tips and insights that I have learned throughout the years with personal experience, and also with the experience I've seen with all of the jaw cases that succeeded after my therapy. As a myofunctional therapist, our role extends well beyond addressing basic issues like lip seal, tongue function, and proper tongue posture. So, through comprehensive education and tailored awareness programs, we enhance our patients' overall well being, including sleep, quality, nutrition, posture, chronic pain, relief, headaches, elevation, and anxiety management through advanced breathing and relaxation techniques. As a mind functional therapist, you can do so much more, right? We can teach them their facial muscle control, while our expertise lies in myofunctional therapy and airway management. It's essential to adopt a holistic view. When tackling symptoms like upper airway resistance syndrome, we must evaluate broader context, considering breathing patterns, posture, the nervous system, pelvic floor health, diet, nutrition imbalances, psychosomatics. I'm back on psychosomatics because everything starts with the mind, right? Genetics, and spinal alignment. Spinal alignment is really important. By taking comprehensive approach, we can better address the root causes and contribute to more effective holistic treatment outcomes. We can do all those as a myofunctional therapist, and even if you are not a doctor, you can. As a myofunctional therapist, we learned in school nutrition. We learned in school all of those things as a hygienist, so we can guide them. We can coach our clients into getting better. We can guide them in who to see, what providers to seek, and what tests to do, what hormones to check, what proper dental devices would work for them, giving them hope that there are great providers that can finally help them, not just dismiss them, because many times those chronic jaw pain cases, they just get dismissed and they go from doctor to doctor. They spend thousands of dollars. Believe me, I was there. I went to so many different doctors, medical doctors, holistic doctors, naturopath, ENTs, jaw doctors. It's just overwhelming, time consuming, and money. Like, it's just expensive, and many of them just give up and they just live with like that, which is so sad. So this course is backed with practical insights and holistic approach, lessons learned from dentists, naturopath, osteopath, and other specialists that work with the body as a whole. So in this course, I'm gonna be having about 12 modules. Maybe I will add. I don't know yet. I'm continuously learning. Today I'm actually at a conference learning new things. So there are gonna be 12 modules. So anatomy of the temporomandibular jaw, why temporomandibular jaw disorders. We all need to start with the foundation. We will go over temporomandibular disorders, patient assessment, what to ask and when, ears, sinuses, and temporomandibular disorder connection, how it's all connected, right? Because we get a lot of those clients that have issues with those areas. Temporomandibular disorders, comorbidities, different conditions, right? And oral facial pain, because there's so much going on with temporomandibular disorders patients that we don't know, right? And there's so many conditions that can give us more information. Myofunctional therapy, safe practices, like what we can do for them, what exercises are safe, what are not, what should we avoid, how we should approach a patient who has EDS, hypermobility, versus just a regular temporomandibular jaw disorder patient. They're different. There's certain things you can do with the EDS patient, but that you cannot do with a regular TMD patient. So you have to know all those, right? Of course, posture habits correction. I'm big on posture because our posture affects the breathing, and our breathing affects the nervous systems. They all go in hand. Hormones, diet, nutrition, because our hormones, our diet, and nutrition affect inflammation in the body. And what is temporomandibular jaw disorders? Most of the time is inflammation, right? And we will go over nervous system and anxiety management. I have so many patients that I've seen that actually, with the help with their either naturopath or medical doctor, right? They stop their anti-anxiety medication that they've been on for so many years. But many times anxiety is just because they're breathing wrong, right? They're mouth breathing, but also because they're in chronic pain. Of course, the body is going to be anxious, right? It's just in chronic pain. Whenever you're in chronic pain, you constantly anxious, you heavy breathe, and you angry, right? Because you're in pain. Your body is screaming out of pain. Your body wants help, and it's just it's a lot, right? So breathing techniques, of course, jaw surgeries and myofunctional therapy would access when to start myofunctional therapy after the jaw surgery, what team we need for patients who had jaw surgeries, how we can help them, guidance, protocols for that, what exercises are safe, what are not, what are we going to use, right? And of course exercises and session outlines. So I'm going to go over what exercises I give for people who suffer with eds, and then who have just temporomandibular disorders, or um, trigeminal neuralgia, right? So there's so many different the pain can come from so many different things. It can come from nerves. It can come from articular disc, right? If there's any issues with the disc, and most of the time, what I see comes from the muscles. So it's myofascial tension and all that, right? So that's important. And then the last and least, I will have some protocols and guides and products, my favorite products that I use and recommend for all of the patients I see. And I will also have research and links to help you get started with those clients, and more like read on more like books, what my favorite books are and stuff like that. So um, I'm excited to begin this journey with you. Together we will explore the secrets of temporomandibular jaw disorders and how to treat it effectively. Let's unlock the keys to successful temporomandibular jaw disorders management and help those people in pain. Let's get started.